We would all agree that cancer patients and survivors deserve safe and effective yoga practices. This is the work of Oncology Yoga. Oncology Yoga is an evidence-based practice that addresses the specific needs of cancer patients and survivors. Let's explore some of those needs. A survivor needs first to initially cope with the trauma of the diagnosis and then face treatments. Oncology Yoga is trauma-informed to best address the physical, mental, and emotional impacts of a cancer diagnosis and its treatment. A survivor needs to take an active part in treatment and recovery. Yoga is a practice of awareness, resilience, and self-empowerment. To some, it is also a spiritual practice. Studies have shown that patients who play an active role in their recovery have better outcomes. The practice of Oncology Yoga can be a deeply rewarding experience, and the physical, mental, and emotional benefits of the practice are felt and observed. A sense of control is restored when practicing, as participants see the positive impact of their efforts, which help to improve recovery and quality of life. A survivor must manage side effects of treatment, from constipation to bone loss, fatigue, or anxiety. The experience of surviving cancer is living with debilitating short and long-term side effects of treatment. This can impact quality of life on a daily basis. An Oncology Yoga practice serves the growing community of cancer survivors because the benefits of yoga are made safe and accessible to best address the side effects and the risks of certain yoga practices, which ones to avoid. And finally, a cancer survivor needs to avoid recurrence. Just as science and research has helped to advance cancer treatments, research has also uncovered the profound benefits of maintaining a healthy, active lifestyle that incorporates daily movement and exercise, and how it can help reduce cancer risk and cancer recurrence. A yoga practice incorporating moderately intense movement in a safe way that supports long-term survival and health is critical. In fact, the survivorship guidelines were designed to structure the needs of a cancer survivor to reduce cancer risk, support recovery, and avoid recurrence. As a reminder, the guidelines recommend a minimum of 150 minutes of exercise per week, identifying active yoga as an approved recommended option. The goals of Oncology Yoga are: meet an individual where they are on any given day. Support all cancer types and stages. Mitigate cancer treatment side effects. Support long-term survivorship. Employ the yoga benefits supported by research evidence. Achieve the survivorship guidelines. These goals help to define Oncology Yoga.